Today I'm working on a preteen that has started to have some acne breakouts and blackheads. I wanted to show you her skin in my consultation and skin analysis with her. Alright, so this young lady is 10. She is just starting to have breakouts, as you see, some blackheads. This is very normal for preteen skin, and this is the time that we really want to get a handle on good hygiene and proper skin washing. So I'm going to talk to this client a lot about how to properly cleanse her skin, kind of what not to do as far as touching her face too much, having dirty makeup brushes if she's playing with her makeup, things like that. So we're going to talk about how to drink enough water to keep your skin healthy, some foods to avoid that could cause breakouts, some products to avoid that could cause breakouts. So really for a 10-year-old, we want to educate. All right, so I'm going to set up my tray for an acne resurfacing treatment for a preteen. So what I need is my cleanser. This is the SQT Gentle Cleansing Cream, and I'm going to use my spatula to get that out so that it stays sanitary. I've got my cotton rounds to wipe that off, and then I've got my SQT Resurfacing set. This one has got the 2 bottles of powder, the dropper, the mask. So I'm going to take out a powder and a liquid, and the mask. Have that set and ready, and then after that we will need moisturizer and sunscreen. So I've got the SQT Advanced Repair moisturizer, and we're ready to go. Liquid. So this is the powder for the resurfacing, and this is the liquid. So we're going to pop these full lids off. There are arrows. See the arrows? You're going to pull from the arrow in the direction of the arrow. So start here where the arrow is, pull that back. See how it pops that? Pull it all the way back and it rips the foil, and then you're going to tear the foil off. So we're going to do that. All right, so take the lid off the liquid, take the lid off the powder, put the powder on top of the liquid, dump that in. Wiggle it, get it in there. All right, put your little dropper on there. Make sure it's on tight. Shake it, get all that blended. Shake it real good. So you're going to take this and go directly to the face with it. So for preteen skin, you're working on congested pores. She's got a lot of blackheads. I'm not going to do any extractions before I start this. She doesn't have anything active that's ready to be extracted, and I'm not going to mess with the blackheads because this is going to do that for me. So we're going to drop this onto the face and spread it just real gently. It's going to feel like sandpaper to your client. Addie, what's it feel like to you?
I don't know, honestly. Maybe like, you know how like dry sponges are kind of hard and stuff?
Yep.
It was like one of those just kind of like tapping over your face.
Yeah, kind of like dry sponges.
Yeah.
So I keep shaking the bottle as I use it to keep the liquid and the powder mixed. I'm just gently doing just wide circles just to get it spread. Just some spreading motions. We're going to use this whole bottle on the face, so you're just going to keep doing this. Be very careful not to let it run into the eyes. The skin will look more and more green as you put this on, as you put more of the biomicro needling liquid onto the skin. It'll start to build up. You want to make sure that your product stays wet. You don't want it to get dry. If it gets dry, it's going to be a little bit more painful on the skin. You can do this under a cool steam. I really do like my cool steamer. I'm not doing it for this video, just so that you can see a little bit better what I'm doing without the steam in the way. But I do like a cool steam. You don't really want to do a warm steam with biomicroneedling because it does get hot. It increases circulation in the skin, so your client is going to feel a warming in the skin, so you don't want to add any warmth with a warm steamer. So again, if you're going to use steam, use a cool steam, and cool steams feel really good with this product. You'll notice as I get more product on the skin, I'm doing more pressing instead of circles. Circular motions are going to feel more harsh to the client, and they're going to be a little bit more aggressive in the skin. Patting motions are a lot more gentle for your client. If you have a client that has a little lower pain tolerance, you're going to want to use patting motions like this instead of circular motions. When I say circular motions, they're going to be like this. So circular motions are going to work the skin more aggressively. Patting the skin, it's going to be more gentle. So you're going to gauge your motions dependent on the skin and your client's pain sensitivity. With preteen skin, you're really just working the problem areas. They don't need a lot of rejuvenation at this age, so I'm not really going to work her temples and her cheeks where she does not have irritated skin and breakouts. We're just going to work the irritated areas. Biomicroneedling is excellent for anti-aging, but we don't need anti-aging here, so we're just going to focus on the areas that we need to improve. Is it starting to feel rougher?
Yeah.
Yeah.
Kind of.
Is it painful?
Not really.
Good. Would you say it feels kind of itchy or prickly?
Yeah.
Around the nose is usually a problem area for preteens and teenagers. They have a lot of oil production and it gets deposited there in that area. So they'll get a lot of blackheads, a lot of congestion, oily, shiny skin in that area. So I like to work the spicules in really nicely there. Resurfacing set is really great for breaking up blackheads and oil congested skin. Those little spicules work their way into the skin and they really clear out those oil deposits and clogged pores. When your pores are cleaner, they look smaller. The chin is usually a problem area. We get extra oil deposits there. We rest our hands on our face. We get a lot of bacteria in that area. So you really want to work the chin area when you're doing acne clients, when you're working on congested pores. This is an area that needs a little extra attention. With your girls, you're going to have problems on the forehead because of bangs, because of makeup products where they highlight and contour. So in your teenage girls, your forehead area is going to have a lot of congestion, a lot of buildup, So the SQT sponge spicules really work wonders to get in there and break that up. For guys, you're working on more bacteria and sweat from sports and their hair on their face and getting dirty. So you're working on teaching them how to clean their face, and this helps to clean those pores out as well. All right, so I'm going to show you what it looks like with the spicules on there so you can tell what areas I worked on most. Did her forehead a little bit. I worked that spot on her nose pretty good. I worked around her nose and her chin. You can see on her lips she didn't have any issues there, so I didn't really work on it. And then on the sides of her cheeks, she was really clear, so I didn't mess with that area. Just focused on the areas of congestion, blackheads, and irritation. I'm taking this off with some cool cotton rounds. I'm going to press to loosen it up. And then I'm going to wipe gently. They feel the spicules even when you're wiping it off, so you don't want to be too aggressive. So press, get it moist, break it up, and then gently wipe it away. Don't be too aggressive. Just nice and easy. Press it, loosen it up, moisten it up, and then wipe it. Gently, I'm just doing a roll pat wiping on the forehead, just gently. Put my cotton. You're going to put this mask right on top of this so it doesn't have to be perfect. Alright, next step. At this point, when you have the mask on, the red light or blue light LED will penetrate through this mask. So if you have a client that has breakout issues, bacteria issues, you're going to use the blue light. Blue light kills bacteria and it's great for acne. If you have a client who has active breakouts and you want to help heal faster, I would use red. Red light therapy, red LED helps the skin build collagen and elastin more quickly and helps heal the skin faster. So if you have a lot of redness, a lot of angry skin, I would use the red light. But this is a perfect time to use your LED machine. Alright, we're going to finish up this treatment. I'm going to take off the mask, wipe off any excess mask fluid, and do her moisturizer and sunscreen. She'll be good to go. I've just got some clean, cool cotton rounds with cool water. Be gentle. Remember, they have spicules in their skin. They're still going to feel those spicules as you wipe this off. Just be gentle. You're just getting off the excess mask fluid. Now, you may still see blackheads as you take this off. That's fine. The spicules are going to do their job over the next 3 days, and they're going to clean that skin out. Your client is going to be flaky on probably day 3, 4, 5, somewhere around there. It shouldn't peel like crazy. It'll just be flaky, and then the skin will be clearer. The little breakouts will go away, and they'll be happy. I'm using the Intensive Restore Cream with sunscreen. I'm mixing those together. You do want your client to have sun protection, and the intensive Restore Cream is great for after procedures. It's a very gentle moisturizer. It doesn't have any active ingredients like retinol, alpha hydroxy, beta hydroxys. So it's just a really good after treatment moisturizer because it's very gentle on the skin. It's going to help heal the skin quickly. So I recommend the SQT Intensive Restore Cream for every client after their treatment. And also the Spongeula Recovery set does help with pigmentation. So when you've got an acne client and they're worried about the post-inflammatory hyperpigmentation, the Spongeula Recovery set is a great at-home product for them to keep the pigmentation from coming after those breakouts. So make sure they wear sunscreen, make sure they're drinking enough water, tell them to please watch their hands, don't touch their face, and if they can stay away from sugar, that would help a ton. So, happy bottom microneedling. I hope you have a great week.